Hi, this is Dr. Evan Chait, the co-founder of Kinetic Physical Therapy, and welcome to our Kinetic Rehab video series. In this series, you're going to learn different exercises to perform at high levels so you reduce pain, decrease symptoms, and live a functional life. I'm going to give you simple ways for you to exercise at home with bands, exercise balls, chairs, staircases, you name it. Welcome, and hopefully you enjoy the series. The next exercise we're going to do, or mobilization technique we're going to do, is the cross ball to the posterior hip. Now the key with this is this could either be done sitting down on the floor, sitting on a chair, or on the bed. The bed is going to be least effective because the bed is typically very soft. Take the lacrosse ball, put it into the posterior hip. Posterior hip is also the glutes. You want to massage the glutes out. Now if you look at my body posture, I want to rotate my knees over to that left side where the ball is. I want to find tender spots. Every tender spot I find, I want to hold it and I want to breathe for 4 breaths. Breathe in, breathe out, breathe in again, breathe out, and you're going to repeat that 2 more times rather. You want to find another spot, 3 to 5 different spots in total, and do the same exact thing again. Now the key with this, it's going to be sensitive in the glutes. And if it gets too easy, what you can easily do is cross the leg over and do the same concept and breathe in through it. Now, as with everything else, if the pain gets worse following this exercise, make sure you speak to your PT. The next soft tissue mobilization technique I want you to do is the cross ball to the gastroc, or the calf. You could be doing this in sitting, you could also be doing it lying down. Now the key is this. You want to put the ball underneath the calf. And if we chunk out the calf into 3 different segments, inside part of the calf, outside part of the calf, and then in the middle part of the calf, that's where I want the ball to go. So you're going to find a tender spot. Once you find a tender spot, you're going to cross the right leg over the left leg. Now this can be pretty sensitive. Again, you want to hold this here for about 4 breaths. Breathing in slow, exhale slow, inhale slow, exhale slow. Then find another spot. Now if we chunk out the calf into 3 different compartments, outside, inside, and in the center, you want to find 3 to 5 locations in each part of the calf. This is going to be sensitive as well. Now if you have a rolling pin at home, you could use a rolling pin at home and you can massage it like this as well. And this can be done in sitting, so you don't have to get on the floor. This makes it much easier for you. In this one, we don't necessarily have to hold so long, but what you want to do is find the tender spot and just roll over it. Next spot, roll over it. And if you can watch my angle change, so this was the outside part of the calf, that's the inside part of the calf, and then this will be right in the center line of the calf. And as with every other soft tissue mobilization technique and exercise we described so far, if you have pain with any of these, afterwards, please speak to your PT. The next mobilization technique is going to be stick to the rectus femoris. The rectus femoris is nothing but the quad, right in through here. You want to take your stick. If you don't have a stick, use a rolling pin. If you don't have a rolling pin, use a lacrosse ball. If you don't have a lacrosse ball, use a foam roll. From here, you want to massage the quadricep out. You want to find tender spots. You want to move to different quadrants of the quadricep. So if you can imagine, we break the quadricep up into 3 positions. 1, 2, 3. Those are the 3 key areas you want to massage. And you'll notice that some spots are more sensitive than the other. Once you find the spot, spend a little time on there. Between 20 to 30 seconds massaging that one spot out. And again, as always, if you have pain following this exercise, not while performing, following this exercise, please speak to your physical therapist. The next exercise is a stick to the IT band. The IT band lies out through here. If you don't have a stick at home, you could use a rolling pin. If you don't have a rolling pin or a stick, you could actually use a foam roll or a lacrosse ball. From here, what I want you to do, you're actually going to massage out and through here. And you want to fish around for the tender spots. The moment you find a tender spot, you just want to spend some time in there and massage it out. Spend about 20 to 30 seconds rolling this out. It's going to be uncomfortable, but if you have pain that lasts after this treatment, make sure you speak to, as always, your physical therapist. The next stretch we're going to perform is called the static rectus femoris stretch, the static thigh stretch. There's two ways to do this. You could do it with a chair or you could do it in kneeling. I'll show you both variations. The kneeling is a progression from the one standing. So if I put my left hand here, you want to make sure you're stable. So if you have a chair behind you, or if you do this in a staircase, the stairs are behind you. You're going to put your right foot in or left foot in. I'd recommend doing both legs. And from here, you want to feel a stretch into the front part of the thigh. Chest is nice and tall. You want to avoid bending forward. Eyes stay fixed and forward. You're going to take a breath in, exhale, and get deeper into the stretch. And how I get deeper into the stretch is I bend the front knee a little bit more. Now, you don't want to bend the knee by compromising bending forward at the hip. Stay up nice and tall. Hold this for 30 seconds or 4 breaths in, out, in, and out. Second variation I want you to do is in kneeling. Now, if you can't get into kneeling, don't bother doing this exercise, okay? But if you can, and you have the mobility, let's have some fun. The knee's gonna be on the floor. The foot is gonna be either on a staircase or on a chair. Same posture here, chest up nice and tall. Try to avoid this position because you're just compromising the stretch. Get up nice and tall, breathe in, breathe out, breathe in, breathe out, and hold that for 30 seconds or 4 breaths, nice and deep. If you want to progress it, you can raise your arm up. Again, with everything we do, we want no pain. You want to modify it, you want to regress to the one in standing if you have pain in kneeling. If you have pain even after doing the stretch, you know what to do. Phone your PT. Thank you very much. The next stretch I want you to perform is the active hamstring stretch. 3 directions. You can do this on a chair, you can do this in sitting, or you can do this in a staircase. With this, from this position, I want you to put your foot up on maybe 3 to 4 stairs or on a chair. From here, pull the toes up towards you so you feel a stretch into the hamstring. From this position, you're gonna rotate the foot in and rotate the foot out. Ideally, you want to be holding on to something surrounding you so you don't lose your balance. As I'm rotating the leg in and out, I'm going to repeat that 10 repetitions. When I turn my foot in, I'm going to feel more of a stretch on the outside. When I turn my foot out, most people don't feel much. Now I go losing my balance. Most people don't feel much. However, the stretch when you turn your foot in, we're actually stretching the sciatic nerve. Rotate in and out. The next position of the stretch is actually rotating to the side that your leg's stretching. So if I rotate my torso this way, where's that beam? There we go. I'm able to hold on to something, very important, and you're gonna rotate the foot in, rotate the foot out, rotate the foot in, and rotate the foot out. 5 to 10 repetitions of each position. Next position we're gonna do is rotate away. So if I'm rotating this way, I'm still gonna rotate my foot in and out as I'm maintaining that stretch. Another critical element of this is Make sure your posture is nice and tall. A lot of people typically try to roll forward and they think they're getting a stretch out of the hamstring when all they're doing is actually stretching their back out. Chest up nice and tall, rotate in, rotate out. 5 to 10 repetitions of each. Please do this in a staircase so you have something to hold on to, or a chair so you can hold on to something that for surrounding purposes so you don't fall. Again, repeat 5 to 10 repetitions, make sure you're breathing. Any pain associated with this, modify the depth of the stretch. If the pain persists, stop and call your physical therapist. Thank you. The next exercise I'm going to show you is called supine leg lock bridge. Now it's a single leg bridge. Now from here, this knee, I'm going to switch legs for better, so you can have a better shot. From here, this knee is up towards your chest. You're going to pull this in nice and tight. It's going to turn the pelvis this way a little bit. Toe is up on this down foot, on this up foot rather. From here, you can lift the butt up in the air, and you're going to come back down. You're going to lift up, and you're going to come back down. Where you want to feel this is in through here. Now the key with this exercise is tempo. You want to go 5 seconds up, 5 seconds down, 5 seconds up, 5 seconds down, okay? The rep scheme is between 15 and 25 repetitions. If the leg starts cramping, take a break, stretch it out, walk around a little bit, and come back. It could happen the first or second time you're performing that exercise because the body's not used to you being in that position. Extremely important to breathe, and if there's any residual pain following this exercise, speak to your physical therapist. The next exercise I want you to do is called the step up technique. Now you can do this in a staircase, very simple. Maybe the first step or second step, you can slowly progress up to a third step. Now the technique is extremely important. I actually want you to have surroundings, so I want you holding on to something on the side. For this, I'm going to show you to do it with the beam in front of you. Watch what happens when I have the beam in front of me. I'm actually bending forward to load this hip on the left side. So if I switch feet real quick, if I bend forward like this, I'm already pre-stretching the glutes on this side. I'm going to switch back. From here, I'm forward. I'm going to step up. Bring the knee up to your chest. I'm engaging my left glutes. My right toe is pulled up, and my knees go into a 90 degree angle of my hip and my knee. Then when I come back down, chest comes forward again. I barely touch my right foot down. I don't want to see this. I don't want you pushing off the back foot to come up. What I want you to do is control this movement. So my body alignment looks good. I'm preloading my glutes on that side. I'm coming up, toe up, knee up, 90. Engaging my glute, straightening my down leg. So if you look at my left leg, my left knee is completely straight and I'm tightening my thigh. A lot of people have a tendency of doing this when they come up. Try to get through that hip and through that knee and then come back down. Now again, tempo is extremely important. We want to do 5 seconds up and then 5 seconds back down. The goal here is to get between 15 and 25 repetitions. I want you going nice and slow, 5 seconds up, 5 seconds down. If there's any pain, modify the height. Go a little bit lower. We could actually do this without a step, and that would look like this. So we don't necessarily need a step in order to perform this movement pattern. If there's pain, continuing pain, following this exercise, make sure you speak to your physical therapist. The next exercise is called the balance reach. And if you can imagine standing on a single leg and drawing a line of a Y, this way, and then behind me, that's going to actually be the exercise. I'm going to stand on my right leg, and I'm going to go forward, and I'm going to go back. Forward and back. If you notice, every time I go forward and back, this knee bends. I'm not doing this. I'm coming forward and going back. This is the knee that's bending. This is just called the driving leg. So that's forward. Next one I'm gonna go is behind me. I'm gonna be on my right leg again. I'm gonna go behind me and back up. If you notice, I'm sliding my toe on the floor for balance. Now if I get brave, I just lift my foot up a little bit higher. Now if you lose your balance or stability, feel free to grab a pole or a beam or whatever to regress it a little bit. The last motion is gonna be behind me to my right side. Whoa, good. 1, 2, and 3. Now you notice I'm barefoot. I want to make sure you're barefoot the whole entire time with this exercise. All right? The key ingredient with this exercise is stability, balance, and motion. So you want to be able to perform the activity without falling over every single time. If you're falling over, you want to hold on to something. All right? If you have instability or pain, you want to modify the range of motion, so don't go so deep. So you can go as far as you can. If that's painful, you just modify. Same thing with this motion, and same thing with this motion. I want you to perform between 5 and 10 repetitions on each leg in each position. If the pain persists or you have pain with all the motions, modify it first. If you still have pain, make sure you contact your PT. Thank you. Now that you watched all the videos, you see how simple and easy it is to perform your home exercises at home. You can come back and review these exercises on a daily basis. We want to make it very simple and easy for you to follow our programs at home so we can maximize your results in the clinic. Hopefully you guys enjoyed. I really appreciate your time and your patience, and God bless and Godspeed.